This is Crystal Fenn from MedPage Today. I'm here at the American Heart Association meeting talking with Dr. Gordon Tomaselli from Johns Hopkins and program chair of the meeting about a trial of antioxidant vitamins for cardioprevention reported here and also published early online in the Journal of the American Medical Association. The randomized trial of more than 14,000 low-risk men found that long-term use of vitamin E and C supplements did not protect against cardiovascular disease.
This is a trial of antioxidant vitamins, vitamin C and vitamin E, in a patient group that's generally healthy with little in the way of manifest coronary heart disease, and in fact little in the way of coronary risk for the most part, largely men, so clearly a primary prevention population, and some might even consider a primordial prevention population, that is, the prevention of risk factors for the manifestation of disease. Again, there's been a lot of debate and controversy about what the role of antioxidant vitamins are in preventing coronary heart disease and other diseases for that matter. There are a number of smaller uncontrolled studies that suggest some benefit, but consistently the larger randomized control trials have been negative. They haven't shown any benefit in preventing coronary heart disease in particular. Again, this is a slightly different population than's been studied previously, and I think the results, one way or the other, will help us to kind of solidify what the recommendation should be for the routine use of antioxidant vitamins in patients at risk. As it stands right now, I don't think there's any evidence that we can routinely say that antioxidant vitamins should be recommended for patients who are at risk for coronary heart disease to prevent coronary heart disease events.
So would negative findings in this trial kind of close the book on antioxidants, or are there other mechanisms or other antioxidants that can still be looked at?
So I think a negative study might close the book on these particular antioxidants and this level of inhibition of oxidant stress to cells. I don't think it negates the overall hypothesis that oxidant injury may be involved in the development of a number of chronic diseases, like atherosclerosis and like cancer. I think the thing that we need to do is we need to understand the oxidant injury better, we need to understand oxidant targets better, and we need to understand how much antioxidant is a good thing, because in fact oxidant responses by cells are actually a good thing in some circumstances, and we have to strike the right balance.
Well, thank you, Dr. Tomaselli. I'm Crystal Fenn, MedPage Today.